Welcome back. The Treatment Action Campaign is demanding Johannesburg's Charlotte Maxeke Hospital reopen fully. The activism group says the hospital's closure is overburdening the other hospitals in Gauteng. Now, to speak more on this, TAC's National Chairperson Sibongile Tshabalala joins us. A very good afternoon to you, Sibongile, and thank you so much for joining us. So, do you feel that Charlotte Maxeke is ready to be reopened fully?
We heard that it was open between this week, and we are really happy about that. However, we feel that other hospitals, it doesn't loosen the burden on other hospitals because those news are not yet publicized on the ground. We heard from our colleagues somewhere who are working for the department that the Charlotte Maxeke has been open, but the burden that has been created by the closure of Charlotte Maxeke, it was heavy on the healthcare system in Gauteng, and it was overburdened for other hospitals like Bara and other hospitals, which they were unable to cope with the measure of the patients that they were supposed to see. And as we know that already in Gauteng, we have a high number of people that are accessing public healthcare sector, and our hospitals were struggling already before the closure of Charlotte Maxeke. Now it has made it worse when the Charlotte Maxeke was closed.
So now, Sibongile, if you're saying that you've heard that the hospital has now been fully opened, what are you now asking for? That the government makes this public news, that they go out and tell every other facility that you can now, relieve yourselves of the pressure that you've been experiencing and bring patients back to Charlotte Maxeke?
What we are asking from the government, because after the monitoring that we have been doing after the past 2 weeks, we have realized that the situation that we have found ourselves as a country in Charlotte Maxeke, we are about to find ourselves in other hospitals like Rahima Musa and Helen Joseph and other hospitals around Johannesburg and Gauteng. Our infrastructure is not up to standard. And what we have experienced in Charlotte Maxeke, we are going to see it again in other hospitals. So opening of Charlotte Maxeke doesn't solve any situation. It doesn't loosen the burden, because in the near future, we'll see other hospitals facing the very same challenge that Charlotte Maxeke have been facing. So what we are calling a treatment action campaign is that our Gauteng government fix the broken healthcare system, fix the collapsing healthcare system that we are experiencing. We are talking about not only hospitals, but also clinics that are not maintained properly. We have clinics that have been operating without water. In Gauteng, we have facilities that are built out of cupboards, which now are so old that the water just comes out from those. When it's raining, the water comes from the ground, and the sisters are finding themselves working in the very bad situation. We have 4 hospitals that were built, or clinics, that were built in 2015. Up to today, that clinic is not working in the West Rand. We have clinics that are very small for our population. So we want a plan from the government to say, how are they going to deal with these infrastructural issues so that we don't find ourselves in the very same situation that we have found ourselves in Charlotte Maxeke.
All right, Sibongile, so now the government comes back and says to the TAC that we are dealing with a pandemic right now. We are still dealing with the third wave. We are still trying to ensure that the vaccine rollout goes on as well as it possibly can, that we clock more numbers every day. We cannot afford to sidetrack and, close down facilities for the purposes of refurbishment. What then do you say to that?
What we've been saying as treatment action campaign, that happened. We've been calling for the fixing of the broken healthcare system from 2012. So the challenges that we are talking about today are not the challenges of today, are long challenges that we have identified, and we've been talking to the government to say, can you please fix this? And we cannot overlook all the other challenges that we have been seeing all over the years, just because of COVID-19 and the vaccination, which is very important. But for us to fight pandemics like COVID-19, we need a quality healthcare system in South Africa. We need quality healthcare system in Gauteng. And when our government, they are saying we are ready to to face a COVID-19 pandemic. We want them to be truly saying that, not what they are doing now, to say we are ready, knowing very well that the healthcare system, the hospitals are not ready, they don't have beds. We've been experiencing a patient sitting or sleeping at the casualty for 2 to 3 days on the chair without beds while they said they are ready. So the pandemic of COVID-19 find us with these challenges. So we cannot ignore what challenges that we had all along just because now there's COVID. While they are vaccinating people, which is good, while we are looking at the issues of COVID-19, which is good, but they also need to look at the long problems that we had. So that these problems have been here for a very long time. So they need to be dealt with. And COVID has exposed all these challenges that we've been talking about all these years. So this is the time for a wake up for our government to fix all these problems as they promised and do what they are supposed to do. They said they are a caring government, they should care, and they need to make sure that we are accessing a better and quality healthcare services in Gauteng and all over the country.
They've, for many years now, Sibongile, lamented budget constraints and the fact that, they just don't have the money to be doing everything that which they've promised that they will do for South Africans. So maybe do you think this is not an opportunity for the private sector to step in and assist them?
As much as we can call for private sector to come in and step in, but it's not true that the government doesn't have money. We are losing a lot of money for corruption. The people from the government, they are always saying there is no money to do the work, but there is money to steal. So we are not taking that excuse. To us, it feels like an excuse. When the former minister, Zweli Mkhize, managed to steal 150 million, then that 150 million, if you can count it, how much it could have been done for the communities? How much it could have done to maintain the hospitals and to maintain clinics on the ground. That money could have done so much. So it's not like in South Africa we don't have money. We do have money, but our government is keeping money on the side so that they can be able to steal. The tendering system that they are using, it's always open doors for corruption. So we cannot afford that now. So now what we are looking at is that there is money. Zweli Mkhize must return the 150 million. That 150 million can do something in the healthcare system. Brian Hlonga stole about 1.9 billion. That 1.9 billion, if it can be brought back, it can do something in the healthcare system. So it's not like that. It's not an issue of that we don't have enough money as a country. We do have money. We have budget to do things. It's just that, how are we allocating that budget? Are we allowing thieves to continue to steal instead of doing what is best for communities?
Sibongile, I am completely out of time, but I must get your thoughts on this. Now that you're mentioning the former health minister, Dr. Zweli Mkhize, he resigned, and of course the president went on national television to thank him for his contribution to the fight against COVID-19. But South Africans are not happy. South Africans are saying a resignation is just not good enough. You are saying he must pay back the 150 million rands. Other South Africans are saying he must actually just go to jail. So what do you say should really happen to him?
Actually, all the thieves belongs in jail. The constitution of this country says we are all equal in the face of the law. If I've stolen something from somebody, I have to pay for that, and justice has to take its course. Zweli Mkhize and his friends must rot in jail for what they did to the community, because they made us to suffer. So I'm with those who are saying they must face the consequences of what they did. So I also support that motion to say they need to face the law, they need to go in jail, they need to be arrested. So all of us, as we are saying, we are equal in the face of the law, and we are saying we are all law-abiding citizens. If that's the case, and if our government is not biased, and if the ANC is saying there are zero tolerance of corruption, then they need to lead that by example. They need to show us. They need to Zweli to jail like other thieves. I'm not leaving out your Brown Hlongas and Katani Mahlangus who have killed so many people and steal from the public purse. Those who are stealing from the communities, those who are stealing from the public purse have to face the consequences. They have to go to jail.
Sibongile, thank you so much for joining us here on Upfront on ENCA. That is Sibongile Tshabalala, who is the National Chairperson of the Treatment Action Campaign.